Hello, all. Very nice to see you all, and I'm very happy that most of you have joined. So, let's begin the session. So, let's begin with AI in healthcare, clinical practice, careers, and skills. So, it's a practical introduction for healthcare professionals and students, especially who are interested to learn healthcare AI. So, let's begin. Let me first start by introducing myself. So, I am Dr. Sanjana Rajesh Upadhyay. I did my BDS, then I started with my MTech in medical device innovation from IIT Hyderabad. I got selected as AI generalist in the very first phase of my placement. Along with that, I have experience in working with AI, especially in medical and dental imaging. I am a founder of one company named as Ryoscan AI Diagnostics, which is just now started, and I have experiences in building grant funded startups, and also I have won national level competitions in this grant funding startups. Why I'm here and why dreams over degrees. So this name is very catchy and is very close to my heart. Sometimes we want to change our careers and we don't know the career opportunities which are available, especially in healthcare, where there are limited opportunities and also the guidance is very less. So what I have seen is there is a gap between clinical education and non-clinical career awareness. So to and also I have seen there is low paying in the very fresh graduates, especially in dentistry or any other skills or any other professions. So I started this dreams over degrees to bring clarity, skills, and options beyond clinics. So my mission is to help healthcare professionals under AI realistically without hype, fear, or miscommunications or misinformations. So, who this is for? This is for all healthcare background students, any student who is interested in AI in healthcare. In this particular session, there is no need to know coding because we have asked this question in the feedback form, in the form which we have registered. Where do you have any coding knowledge? So mostly people did not had any coding knowledge, because obviously if we are in healthcare, then the coding knowledge is on a lesser side. Along with that, this session do not give any job guarantee. I cannot say that by doing this one session you will get a job in non-clinical corporate AI roles and all. But this is a basic overview. Along with that, also it is not meant for very deep technical knowledge. It is meant for everybody with low technical knowledge, and even healthcare people can understand. So the core message is this session is for clarity, not mastery. So, what you will take away? You will take away an understanding of what AI roles are, especially in healthcare. You will see clear paths, that is, you can explore careers and job pathways where healthcare and AI intersects with realistic expectations. There is no hypes, and actually, this job roles exist in the market, and actually, this kind of startups are going to be emerging, and we are seeing this system here at IIT Hyderabad where I'm studying. Startup is something which is at a boom, and people are growing their startups, even especially in healthcare as well. So, and also you will know where to start, what kind of skills you need, and all this will be covered in the sessions. So please be with me and be patient, okay? So what AI really is. So for any person who don't know what AI is, then I would say AI is nothing but pattern recognition. That is, what AI do is it understands the patterns. For example, if even if in financial things, like in stock market, if there is one thing where share markets are going up and they're going down, what is the trade line and everything. So AI can understand that. In the same way, if some doctor is prescribing some medicine for certain disease, the AI will learn the patterns. He will learn what patient wants, what doctor says, and what is this communication. Along with that, if any x-ray is taken, for example, kidney stone x-ray or ultrasound is taken, and that knowledge is fit into the AI, the AI will learn patterns, that what exactly the pattern is of a kidney stone looks like. And then if another x-ray is given of the same kidney stone but the data was not fit into it, then also he will be able to predict that. Why he will be able to predict? Because he is knowing what is the pattern of a kidney stone looks like. Same goes with a very simple example, like if cats and dogs images are fed into AI models. Then the cat, what is the pattern of a cat, how a cat looks like, AI will understand how a cat looks like and he will predict if a new cat image is given. So this is how pattern recognition works. And what is data driven decision? So these are some few words which are the buzzwords in the field of AI. Pattern recognition. I would also recommend if you have any paper or pen, so that it will be helpful for you to have notes of these things. So it will be better to take notes as well. So what is data driven decision? That is, whatever data, images, let's say records or anything which has been put into the AI, that data is being learned by AI in the models, and then he gives the decision or the prediction based on the data it had before. So that is nothing but data driven decision. Also, it does not have human intelligence. For example, if something he is predicting, but he do not have the emotions to say the thing very in a very sophisticated manner. For example, if someone is having cancer and AI is predicting that the person is having cancer, directly is saying, so you have this. This is very not good to say such type of words, but that thing AI don't understand, it does not have emotions. So for that, this is the difference between a human intelligence and AI intelligence. And also it should be backed by the doctors as well. So AI is like a very fast junior assistant. It is not a doctor. So let's go forward. Why AI is already, where AI is used. So AI is used in especially in healthcare, in radiology, especially where AI is going to not diagnose, but actually red flag and give some predictions. For example, if a brain tumor image is given, if a kidney stone image is given, if any X-ray of your tooth is given, like I myself, the Ryoscan AI diagnostics works in the field of dentist related X-rays. So if any X-ray is given, the AI will predict where exactly is the caries present, where exactly all the anomalies are present. In pathology kind of images, what will happen is it will detect what kind of pathology images are given based on the data which is provided to the models. And also in documentation, especially in healthcare, there is a wide range of documents which are available, because there will be patient doctor data, there will be prescriptions, there will be times, there will be X-rays, and there will be appointments and insurances. If the patient has any kind of insurance, the all these bills and everything will be available for will be present in healthcare data. So healthcare is somewhere something which has a huge amount of documentation, patients appointments, all these things come in this documentation. So AI is going to be used in this documentations as well, where the documentations will be given in such a way that if we put certain prompt of, if we want this type of data, then that type of data will be given to you. For example, if you want patients who had this disease, and you want to see what were those patients, you as a doctor don't remember that what person has that had that disease, then that documentation AI can give all those things to you very easily. So why AI plus clinicians? In this workshop, we have around 50% of doctors who registered. I'm very glad to have you all. Along with that, we had around 40 to 50% students who are in in healthcare backgrounds as well, like all those backgrounds. But why AI and those medical backgrounds can intersect, and it is going to be a future in healthcare. So not just engineers, but what doctors can contribute is they will have complementary strengths, because especially us, we have all body knowledges, we can understand what the person is speaking and what is the disease, what are the outcomes, and all those things we know it. So if someone wants to build AI in healthcare, whether it be medical devices which are there in the market, whether it be any softwares which are going to automate the works of clinics or hospitals, big multi speciality hospitals, all these things will be done by, and if it is done by doctors, then the things which we build is going to be very good. So doctors who understand AI will lead, but doctors who ignore it will struggle. I would not say struggle, but it is written in the slide, but I would not say struggle, but it will be difficult for them to adapt in future, because AI is going to be there, and if you are someone who is up to date, you are a clinician, you are up to date, then it is going to help. So let's speak about numbers, and let's speak about the real world examples of AI in healthcare. So one is AI receptionist startup for healthcare, and this is a big opportunity. I'll explain you what it is exactly. So AI receptionist startups for healthcare is nothing but where um, a receptionist job has been replaced by an AI chatbot like thing, or even or a chatbot which is going to give the appointments, bookings, WhatsApp replies, follow-ups, report sharing, payments. Everything will be done by this AI receptionist. So can you imagine what kind of workload and payloads of a doctor is going to reduce when AI receptionist startups and AI receptionist has been integrated in all the dental clinics, medical college, medical hospitals. And even if we do not take away this AI receptionist, but we do not take away the real human receptionist, but the real human receptionist job will be very helpful with the help of AI receptionist. So cost of healthcare AI chatbots. So to build such type of chatbots as a startup, these is the money which is various kinds of thing. Along with that, what clinics can pay for AI X-rays. For example, if you have built a model where your X-ray is able to predict what kind of diseases are there in that X-ray, then one clinic can pay around 50 to 200 rupees per scan if you have that model. Along with that, there are monthly subscriptions which can be provided. Enterprise hospitals can pay you that amount of money because it is going to be automated. It can give decision making support platform. It can build patients trust, because even if a machine is saying the same thing, doctor is saying the same thing, it will act as a second Google in the future. Doctors in the future, patients will think that this AI is also predicting the same thing based on the data which is it has trained, and the doctor is giving the support and saying that yes, what our AI has predicted is correct. Then it is going to give more authenticity. It is just going to be a decision support. So these are some real numbers and real examples of AI startups or AI which is going to be integrated in healthcare. And right now there are n number of startups which are working in this, like X-rays, receptionists, chatbots, also telemedicines, and all these things as well. So what types of roles AI, what are the roles? Like for example, in the workshop form, we have asked why you exactly want to join this workshop. So most of the students said that, most of the people who joined said that they want a clear understanding of what are the career opportunities in AI in healthcare or AI jobs. So I have made a dedicated slide for this. So clinical adjacent roles. Let's say if you are a doctor or or a healthcare professional who don't want to leave their careers at clinics, but you want to have AI beside you to guide you or to help you with your clinical work. So this section, the very first section, is for them. So clinical AI specialist will implement AI tools in clinical workflow. Let's example, if you want easier patient reporting, and if you want easier appointments booking, if you want easily to know that what kind of patients came today, what type of treatments I did, and you want such type of dashboards, then that can be integrated into your clinics. Medical AI consultant, you can advise AI adaptation into the clinics. You can become someone who is able to validate the AI models which are built. Along with that, digital health lead, you can also become one person who can give AI information, who can give healthcare information from a far away space. Along with that, industry roles, so this is very important, and this is where in the very first group, that is clinical adjacent roles, in that type of roles, much knowledge, much gaining of skills is not required. Only you should know how to use the AI tools. But if you actually want to transition your career from a non-clinical background to from a clinical background to a non-clinical background, in that type of cases, you want to learn certain skills, and that skills will be spoken in next slides. So for example, let's say a product manager role. These are the kind of roles which you can have in a non-clinical careers, especially if you're a healthcare professional. So you can help designing AI powered healthcare products, because you will understand what the product is, how is the human body associated, and how this product can link with this person. You will understand because you were already into the clinics and you already learned how human body is. So that is how you can become a product manager. You can become medical affair leads, because you will understand what are the legalities, what are the regulatories which are responsible for building things. So you can become an healthcare consultant. There are very big companies, example ZS Healthcare. ZS Healthcare provides initial consultant salary as 12 LPA, and then it goes up to very high. And also sales and marketing in marketing. For example, if you're a doctor, you want to have an part-time job, or if you want to have a full-time job based on your career transitions, you're a doctor, you can explain to other doctor very clearly. The terms are very clear to you because you understand what are the things. So you can become a person who can act as marketing, you can act as healthcare consultant, you can act as affairs lead and product manager. Innovations and research is where you actually want to learn the some amount of coding, some amount of skills which is required. There also, you can also become a startup founder. Right now I have attended a attended a competition where one lady was actually a startup founder, and she worked in endocrinology, where she built a startup and it was actually booming. She had around 2 crores of funding for her startup, and it was like they used to go to homes of people and they used to collect the bloods for getting the diabetic results. The endocrinology reports, what are the HbA1c reports, will be taken from the home and will be delivered to the person directly. So that kind of complete chain she built. So you being a professional, you should not think inside the box, you should think sometimes outside the box as well. If you are a doctor, you are having a clinical practice as well, you can think of having a startup as well, because uh, right now healthcare startups is something which is very booming. Along with that, government is also providing so much amount of funds for this kind of initiatives, because in India, employment is employment is not there, especially more. And you may have known that in um, these things as well, healthcare as well. Initial graduates, BDS comes out of a college and there are no job roles. If he don't want to open a clinic, then there is no other way than going into a other person's clinic and working for at, I don't know, like at the start the pay is very less. So in that kind of cases where you actually want to transition your career, you want to learn skills, then this is what you have to do. After, how much you can earn. So this slide is something which I kept for kind of motivation, or not motivation, but something which you should know. So let's say a healthcare data analyst may earn from 4 to 8 LPA depending. Afterwards he may earn more. This is the initial salaries which I have mentioned. Along with that, if the clinical AI consultant, for example, if you are consulting for a radiology, if you're a radiologist and you want to consult a company who is building actually products into radiology and getting the models developed, and you know exactly what kind of the images are and what are the problems in that images, then you can get around 8 to 20 LP as a clinical AI consultant. As a AI product specialist, if you have the healthcare knowledge and if you have the AI knowledge as well, you can become an AI product specialist, and it will be 6 to 12 LPA. And senior roles, it may from 15 to 30 plus, it may also go. There is no limit for this kind of roles, depending what life you want. Do you want a life which is always into clinics, or you want to transition as well? So that kind of, you have to decide on your own. Along with that, what AI cannot do. So this is something which is very important to know at this stage. What AI cannot do is AI cannot take responsibility. That is, if AI is predicting something, then it should be backed by a doctor. Even if the people who are from pharma background or any other backgrounds as well, so they should also know this kind of things, because whenever they try to build some models going into pharmacy or anything, AI is not going to be responsible for what it is predicting. It will predict, and it want decision making support by doctors, and that is where a doctor's role can never be replaced. I see people saying that engineers can be replaced by AI, but I will never say that doctors will be replaced by AI, because always the AI will have AI should be backed by the clinical validations always. Also, cannot be handled uncertainty. For example, if there are any rare cases, that also AI cannot handle, because for rare cases understanding, the data should be provided to the AI first, and then only everything can happen. So the medico legal reality that doctor is responsible in the same what I have spoken in the last slide. AI is just a decision making support platform. Like it will just give a decision support. If the doctor is saying that in this x-ray caries are present and AI is saying caries are present, it is doctor's end decision to say and write into the patient's report that yes, caries are present. So if the doctor do that, then only that report can be handled to the patient. Even if I, as a startup person, as a startup founder, if I pitch in front of investors, they ask me this question where they say that will you go beyond doctors? I say always no, I cannot go beyond doctors. AI can always be on the level at this point, and it cannot be above that. Ethics and regulations also matter, because all the AI based platforms, all the medical devices which are made actually in medical industries, all those needs FDA approval, patient consents, algorithmic biases, transparency, and professional liability. So this is what I want to say, that always AI should be backed by a doctor human in loop approach. This word is very important, human in loop. Human in loop is always AI is handled by a person who is responsible for forwarding the information to another person. Let's take a very simple example. If you have asked chat gpt to write an email, it's your responsibility to read that email what exactly it is written. You may not directly copy it and send to your professor. Sometimes it will give things where it is said that anything else you want. I have seen people who directly send it to professors, but so you have to re-verify it, and that is why human in loop is there for all kind of AI rules. So let's have some break here and let's have some discussion prompts with you all. So I'm very happy to have you, and I would like to ask, what is your, you may start with what is your field, and where do you see AI coming into your field, and also you can speak about what exactly motivated you to join this workshop. So I will be very happy to hear from you all. Anybody can say.
Ma'am,
Hey, hi.
Yeah, yeah, Sarita, you can speak.
Yeah. Hey, hi, Sanjana. It is good to know how AI is helping in doctor's world. Actually, this was something. I mean, I'm not a doctor. I'm into tech world, but I'm learning about AI and ML model and everything. So I'm just wanted to know like how AI is helping and solving the problems of doctors. So it's very good to know like one line that I really like catch is like AI can't take the responsibility. So it provide
Correct.
you the only the suggestions.
Correct,
So
correct.
you need a backup from human as well to make it as uh, what you call proof. Yeah.
Yes, correct. Thank you, sir. Thank you, Sarita. Thank you. Anybody
Yeah.
else? Any doctor or any other person who wants to say something?
well, hello Sanjana ma'am. Myself, Prabh Agrawal. I am from BPharm third year.
Hello.
Actually, my question is, what is your startup? Like, actually, I am working on a AI healthcare system, but I'm not sure about it, like how I will start it or how I have made a MVP. So I'm just uh, want to know that what is your startup, so I can know about it. You know.
Yeah, it's like we are developing an AI-based multimodal dental X-ray analysis platform, and also we are going to give multilingual reports for the patients as well. For example, if a patient is, as India is a multilingual country, then we are going to give patients reports on their own languages, and the X-rays will be analyzed through AI, and AI reports will be given.
Oh yeah, yeah. I recently did that project and able to get it. That's a great thing, by the way.
Nice, nice. Uh,
Yeah, hi, Dr. Sanjana. This is
Hi,
Dr.
hi.
Venkatramana. So currently I'm working with IntelliHealth as a clinical director. So I will be working on drafting the different kind of clinical protocols, and will be evaluating the AI generated from the different LLMs. Okay. So
Okay.
we are, I think we are working on to build the AI features into EMR, which will assist the doctor and the health workers also. Okay.
Okay. Okay.
uh, I have maybe right. I think as a clinician, I think we'll be more interested to evaluate the LLM's output or AI
Yes,
output.
correct, correct, correct.
Only the
Actually,
thing
this
is
kind of
whether, yeah, sorry, maybe
yes,
just
yes.
I will take 1 minute, then I think give it over to you. So like learning a Python by a clinician, is it going to help the tech team, right? Or it is not
Yeah.
required?
Actually, I am going to come to all those things. Also, I have some questions in the chat board saying that what are the career pathways and everything. Can you explain? So all those things also I'll be coming in the next slides. And regarding learning Python like type of coding language by a clinician, is it going to be helpful? So I would say yes, it will be helpful if the clinician wants to get into a non-clinical job. Python is like a very basic language which everybody should know if they are into ML building and model buildings, deep learning buildings. Why? Because even if they are not going to hard code all the things, but they are going to interact with the technical team. So if the technical team is saying that we are facing this type of issues, and if they show you some kind of codes, you may not write the code, but you should understand what is written inside the code. So that is what I feel is important for clinicians to enter into non-clinical role, even if a non other backgrounds as well.
Great, great. Got it, got it. Thank you, thank you.
Yeah, can I see the chat box?
Hello,
Hello, hello.
hello, ma'am.
Hello, hello. Speak.
Ma'am, basically, I am working in brain-computer interface,
Okay.
and few minutes before you are explaining human in loophole.
Correct, correct. Human in
So,
loop.
can you explain more about this?
Yes,
Sometime.
human in loop is like, for example, if an let's say I will give your own example. Let's say if there is a brain tumor inside the brain, and the MRI results shows that brain tumor is present, and then and it is also predicting what kind of brain tumor is present. The AI is predicting, but always in radiologist opinion on that is required to under. So directly AI's decision cannot be given to the patient. It should always be a human which is going to understand what output is given, and then only that type of result should be given to a patient. Because maybe sometimes it is predicting wrong, maybe it is sometimes hallucinating, it is not correctly predicting the results. So that is the reason why human in loop is always required. Iterations are required. Always you should verify what the results AI is given. Even if you have put some prompts into getting the slides ready, you will evaluate what kind of slides the AI has made, and only after that you will go and present it in front of a huge audience, right? So that is something which is called as human in loop. You will not believe AI completely.
Okay, ma'am. Thank you. I understood. I understood.
Yes.
Hello,
Okay.
hello,
Hello,
Sanjana.
good evening.
Hi.
Uh, Hello. Hi, Sanjana. This is Twinkle. Currently, my story is also little bit like you. Like for me, it is from technical then medical kind of thing because
Okay.
currently I'm working at ICMR
Okay.
as a project research scientist. So,
Okay.
like initially, I've done BTech in electronics and then MSc in statistics, mathematics, and then PG diploma in data science, machine
Okay.
learning, and
Nice.
Okay,
Nice.
so like currently, my work is that project we in which we are working is a bioimpedance, and we are doing binary classification for oral lesions, like image segregation into cancerous and non-cancerous, and then
Okay,
we
okay.
building device. But that project is like about to finish. The data which we are taking is mostly of Northeast region, the 7 states of Northeast,
Okay.
like. That project is like about to get over, and I have also worked there in one more project that was on pathology related AML,
Okay.
like acute myeloid leukemia was there in
Okay.
that. So like that's why like my interest now is aligned to AI and health. Earlier I joined there as just as an tech person, but after reading and working there, I got interested in AI and healthcare domain,
Correct,
like
correct,
in that
correct.
way. So
Actually, what the field which you are working is in the oral cancer. So India is the one of the biggest place where oral cancers are
yeah,
present.
yeah, yeah, we
At the
have.
same time, yeah, at the same time, the data from which you collect is also matters. Like for example, if you are saying that in the northeast region you are collecting, the data comes from the Indian data set where what kind of cancers the Indian people get. That is also very important to build a actual model who can predict all these things. I have this type of I have known the startups who are working in this domain, predicting oral cancers, oral
Okay,
lesions
okay.
through scans, oral scans.
Yeah,
I
yeah. We
also
are actually combining it with bioimpedance device. Like we have already done
correct.
that. Now the our job has been over. Now like the internal works are going on. Bioimpedance device, actually that device measures the resistivity of the, like the
Yeah,
current.
yeah, I am aware of it. Actually, I worked
Yeah.
as an intern in such type of company as well
Okay.
before all this. So I know what kind of work you are doing. It's very good, Twinkle, to have you here.
Yeah, yeah. So I like if there is after some time the project will get over. So I am very interested in like knowing
Correct,
if
correct.
there is any opportunity to work with you or anything. I would be like happy to
Yeah, yeah.
join.
I will tell you if I get something. You may message me or email me. I will let you know if something
Yeah,
comes.
yeah, yeah. Please do share your email and details at the end. Okay. Okay.
I'll take some questions from the chat box as well. So yeah, pathways for BHMS graduates also. See, if you are a BAMS graduate, if you are a BHMS graduate, any healthcare graduate, it does not matter what kind of degree you have. So this is what you have to know. You should never segregate yourself from any other healthcare background. If you are going to transition your field, then any healthcare degree is same. Even a pharma background is same. BHMS background is same. Only you, if you want to actually transition, all the transitions will be same. Like for example, if I am a dentist and another other person is an MBBS person and he wants to transition into a career name, say healthcare consultant, he will transition into the same career only. There is no bias for what kind of degree he had in the future, in the past. So it is same. Along with that, how can I enter into AI okay. After BSc? So same question. BSc technology also same. When you are going to transition, it will be always same. Only I would not say competition. Like maybe a MBBS graduate may be preferred if he is going to be having both the knowledge. But if you gain a technical knowledge in a good way and you actually approach right people, then for sure there is no bias in that as well. And working in medical image analysis and
Hello.
disease assessment can be done with the help of medical persons. Suppose. Yes, that from Priya Singh as well. The question that I'm a PhD scholar and working in medical image analysis. So yes, disease severity can be done by medical personnel. Actually, it should be done by medical personnel, and then only if it is. If I don't know like what kind of, if you are using AI into it, then obviously you need that data which should be assessed by the medical professional. Yeah, about that startup sessions also, I will be conducting a separate one. I cannot cover everything in this one particular workshop, so I will do that. Same BDS graduates in AI and same question, same answer that any person can get into fields provided you learn proper skills and approach right people. This sentence is also very gold. You should be able to approach right people. They say right, real value is given to a value of a person is only happens when he gets the value correctly, like he goes to a right person. हीरे की पहचान, वो whatever that word is, so जौहरी से ही होती है. So वो जो है वो it's like if you want to actually explore into your career and actually boom, then you should be able to find right people, continuously use LinkedIn, and that also will be shared in the next sessions. Grants, fellowships and everything will be covered in next sessions, next workshops. Regarding how to start AI now, we will start in the. So I believe that we can start with the slides now, and I'll take the questions at the end as well. So let's begin with the slide, okay? So why healthcare people matter in AI? It is like they have domain knowledge, they have safety understanding, and they have clinical thinking. So they will be able to think clinically and then give some ideas to the startup person or any companies or any consulting companies, all these things. So their mindset is they have seen many patients, they have seen how actually clinical world works. So if you are someone who have both the knowledge, it is going to be very helpful for you. This is the slide which I would like to say, that is job switch reality. And let's say if you want to switch your career from a BDS graduate or any other healthcare graduate directly into a non-clinical job, so there is no instant switch that today you are a BDS and tomorrow you become an AI expert and you go. It is not going to happen. It takes time, it takes patience, and it takes you to be who is easily moldable. If you are able to mold yourself, then it is going to be very easy to adopt any kind of skills. No jobs from certificates alone. So if you think that you will get some certificates and you will get jobs, that is also not true. You should actually search for jobs, you should actually do that grind, and then only you will be able to land up where you actually want to be. So you should be able to have skills, projects, and positioning yourself correctly on the LinkedIn, correctly in front of your interviewer who is going to take you. So this is a timeline which you should expect. Let's consider that 1 to 2 months it will take for build foundations of AI literacy, to understand everything, explore the tools. 6 to 12 months to build projects which are actually good to showcase on your CV. I don't say that 6 to 12 months where you don't earn anything. You may earn in this period as well, but that is what you should expect. You should give yourself time to transition if you actually feel that you want to transition. So where these jobs exist. So first is health tech startups. As I said, that there are many startups who are emerging, especially in AI and healthcare or any medical devices. There is one Zomato founder named as Bhipendra Goyal. He has also started one startup named as Temple. So it is also well funded startup. There was one post where he was wearing a device on his head, suggesting that how this stress can be managed by that device. So this type of startups are emerging, and those are the places where you can seek job opportunities from. Along with that, hospitals and labs. Let's say I get people asking me what is MBA in healthcare. So MBA in healthcare also, if I have personally known some few people who did MBA in healthcare and actually are now doing hospital management. They are so as they understand, if they do that as well, so those are the also places where you can get jobs. Along with that, medical devices companies, as I have spoken, like for example imaging manufacturing companies, and if any in dentistry there are many equipments which we learn about. All those companies also, there are job opportunities. Surgical robots, robotic surgeries are going to come into the market. Huge R&D team is required to build such type of products. So all these places where a doctor understands all the clinical aspects, and a doctor or even a person who knows healthcare or who knows the biology part of thing, he may learn the skills and also apply for jobs in those kind of companies. Research organizations where universities, research labs. Here at IITH also, you can go in any kind of IITs, I'm speaking, not just IITH. There will always be forms rotating for research fellowships or research things where you can apply, get a research fellowship for around 6 months to 1 year, work in a project. There are projects such as saliva. From saliva, they can think about the toxins which are available, and whatever the toxins are available, all these things. There are a number of projects. So in this type of research which are going in this institutes as well, you can apply. So that is where also you can gain the knowledge and you can build up your CVs. So this is a slide where which is dedicated to make you understand where these jobs exist and how people actually get these jobs. So what you should do is, number one, you should do networking. You should have your role clarity. Role clarity is, I believe, very important, because there is a huge set of things which a person can go into. A person can go into research, a person can go into AIML, a person can go into medical devices, robotics, huge opportunities. But a person cannot learn everything, right? So he must be able to understand what he wants to go in, and he must learn and acquire those kind of skills only. Let's say you want to have something in AIML, then you should learn coding, you should learn what are deep learning models, you should learn tools, you should be able to run models. This is not going to be very hard if you, provided you give yourself time and you actually invest your time into learning this type of skills as well. So first you should understand the role clarity, then you should build your portfolios, and then enter through internships and projects. Let's say any company needs you to needs to assess you based on how exactly you are you a credible person to give that kind of money or not? So you should start with internships, build projects, and you can directly approach people on LinkedIn. LinkedIn is very nice place where you can actually go and approach people. You can actually message people directly saying that I am this person, I have worked in this way, and please give any opportunities which are available. Let's say you message around 1,000 people. From 1,000, 100 will be not 100, but let's say 10 also, if they reply, then it is fine. You should not have shame. This is also I want to say, I don't know like what kind of audience I'm addressing this to. So it's like when you are finding a job, if you are switching your careers, then you should not feel shy of asking people the opportunities, because you're not someone who will get opportunities and everything will fall into your lap. You should actually search for them, you should speak to them, you should ask for opportunities, and if the person is right, he may give the opportunity as well. So this is where you can actually find people. You can always use LinkedIn. LinkedIn is a very good and also keep your LinkedIn profile up if you are actually trying to switch your careers into non-clinical backgrounds or AI and anything. So what are the skills required? So as the question was given in the chat box as well, so what are the skills required to transition into this kind of roles? So let's say if you're a professional, healthcare professional who want to transition, there are, the one first layer is 100% AI literacy you need. That is, you should invest yourself in learning how AI is actually working, and you should have that literacy. From this workshop, I believe at least 30% literacy you already have. It is not that vast. 30% literacy you will have from this workshop. Afterwards, tools. Tools is like 70% of the AI tools you must know. Like tools will be very simple. For example, analytics के लिए कौन सा tools use होता है? Like what kind of tools are used in analytics? How a professional can build presentations very nicely. You cannot ask ChatGPT to build presentations. You can ask prompts to ChatGPT to give you, so that you can give it into another AI platform. Example, Gamma slides, where you can give the prompt and the Gamma will create slides for you. These slides actually are made by AI. So they are tailored with AI, and we are actually using this type of slides. So afterwards, along with that, coding is only 40% or less than that. I myself am a mediocre in doing coding, medium level of coding I know, but I believe that coding is something which you must understand. And then advanced ML and DL knowledge you should have 20%. That is only 20% of ML and DL knowledge you should have. So this is something which you should have. And I would say that in this world, if you are shy of telling that I'm using AI, then that is not going to be helpful for you. Everybody is going to use AI, because AI is going to help you reduce your time and make things look very attractive. And that is why you should actually go out there and use this kind of. Then yeah, AI literacy. So this is a slide which is where I'm going to be like slightly technical. I'm going to introduce to you. I don't know how many people have heard about these words and what kind of audience I'm addressing correctly. So first one is what ML means. ML is machine learning. Machine learning is nothing but when a computer learns patterns from data without being for every scenario. For example, machine learning is, as I have said that machine learning is nothing but pattern recognition. It recognizes the patterns. So let's say it has trained for 100 images of kidney stone, and if I give the data and if I give the model 101th image of kidney stone, he will be able to predict it based on the data which was provided before. And this is nothing but machine learning, that the machine has learned the based on the 100 data, and it is able to predict and month data without being labeled. So that is nothing but machine learning. That is, it is not explicitly programmed to say that this is kidney stone, but it is saying that it is kidney stone based on the knowledge it had before. What DL means, it is just an extension of ML. That is deep learning. Deep learning, it uses neural networks. So if actually you go deep into it and you have the further workshops which I'm planning to conduct, then you will be understanding what exactly this deep learning is and how these models are. If you are going to train images, let's say radiology images, in that images, deep learning is something which is going to be very helpful. And what is data? From the start itself, I'm saying data, data, data. What is this data? Data is nothing but any sort of documentation, any sort of images which are provided to the models so that he can make predictable decisions. So these are the three things which are very important. And in AI literacy, this is, let's say, this is the ABCD of AI literacy. So no maths, only concepts. In this, if you actually go into deep, then there are so many big equations which are available. I have attended deep learning lectures from IIT Hyderabad professors, and they give big maths equations, but that is not required for healthcare professionals. So you should not think about it. Only this type of knowledge is needed at this point, and even to transition into any career. So no coding versus coding. So what is no coding versus coding? As one person asked, if a person, even a clinician, should learn coding or not. So yes, if you don't want to learn coding at all, then also there are some roles which are going to be helpful. But knowing coding at a certain basic level is important. Basic to medium level is important. So you will have you can begin with using AI tools immediately if you don't know coding as well. But if you need to do some programming, if you need to build something from scratch, and if you actually want to work in a company from the scratch, maybe some little amount of coding you may need. So Python is, how much Python is enough? So basics only. You need basics only as a professional. There are YouTube courses where they teach the in-depth Python, but that is not needed. What I feel, there is no tailored course available for healthcare coding. Like how much coding is needed for a healthcare professional to transition into this type of roles. So I have tried to build that type of contents. I have plans to build that type of content to understand, because I have struggled for it. I struggled in learning coding, and I know that how much coding and healthcare mind can understand. It cannot understand so much technicalities, because giving yourself around 5 to 7 years or more than that years into where you are actually learning and mugging up things and actually going into coding and thinking differently is not going to happen. So you should understand only basics of coding. So this is some platform which is Google Colab. I will not be explaining much about it because if there are some healthcare professionals, they may feel this is very new for them. But this is a tool which you should understand if you want to become an AI ML engineer, or if you want to become someone who is related to AI in healthcare, you actually want to learn models, then Google Colab is something which is going to be helpful for you. And this is what you have to learn. And I am not going to explain it in this workshop, but yeah, you can write it in somewhere that Google Colab, you should learn how to actually train the models, and everything will be done on this platform. ChatGPT for healthcare learning. So right now the students in healthcare are using ChatGPT. At my time, ChatGPT was not there. I actually referred test books, but ChatGPT is actually helping a lot for this healthcare students, MBBS students, BDS students. They are actually using ChatGPT to tailor all the answers and giving all these things. So learning concepts, research summaries, and documentation drafts, everything is done by ChatGPT. But to understand the potentials of ChatGPT, you should understand how to use it. I myself has used it, and I will be very happy to suggest things like where exactly this ChatGPT falls into healthcare as well. So ML and DL workflows. So let's think as if you don't know anything of it, and I'm going to explain it from the scratch. Let's say you have data. Data is nothing but, let's say you have 100 images of dental x-rays having caries. So that becomes your data. Then this data is given to a model is nothing but, you will be learn, it is a set of codes, and some coding is there in the backend. Let's be very simple in the terms. So some coding is there in the backend, and if you give that data to that model, it is going to do training. It will train, and it will train, and it will learn the patterns. As I said, what is AI is nothing but learning the patterns. It will learn the patterns, and then it will give you outputs in the sense that how accurately I'm able to understand what images you gave me. So, and then he will be able to evaluate. So even if I have given 100 images of caries to the model, he has learned only on 100 images. But if I give him the 101th image, he will be able to predict where exactly the caries is present in that image. So that is an example of AI in healthcare, a real world example, an example where actually I am working in the startup which I am working. So this is exactly the pipeline of how AI ML works and how AI in healthcare is going to work. And if you are someone who want to transition in AI especially, this is the pathway which you should understand. So AI tools which doctors can explore if you are a clinician here, then documentation tools, AI image analysis tools, and research tools are something which you can learn. So what not to do? Don't chase certificates blindly. Don't give so much money to certificates. Let's say lakh rupees if you have given. If don't compare with engineers. If you are a healthcare professional or even a very core BSc person who is into mathematics or like that, don't compare with engineers, and don't overload yourself. You will take time, you will learn through basic steps, and that is how you will able to learn. So there are these three possible paths. You can become a better clinician by using an AI. You can actually switch your careers, and you can have early preparations to build. You can have early preparation into switching AIs as well. So what comes next? So here I come to an end of my workshop, and I was very happy to conduct this for all of you. So we have designed a 1 month of program for you all to have this AI in healthcare in your mind and to understand how this AI works. It's going to be a 1 month program. It was going to be 4 weeks, 2 days, Saturday, Sunday, 1 hour. 1 hour you will be able to join, I guess, mostly. It is hands-on learning, will teach you tools, and it is live, beginner friendly, designed by healthcare professionals, that is, who actually understand what amount of coding and all these things are needed. Then real world AI use in healthcare will be taught. What will you learn? You will have hands-on AI projects. You will use ChatGPT efficiently, how exactly you can use ChatGPT and build actual models, career pathways and opportunities, and learning outcomes. But this workshop does not, like this course will not guarantee you jobs. That is what I should say. But it will give you a sort of motivation that you actually learn some skills. And program structure and commitment. I have put some money to the program because actually I wanted to do it free, of course, because I have myself faced a point where there is lack of knowledge about what are the career options available. But free की चीज की value नहीं होती. There is no value for anything which is given for free. If I take this workshop for 1 month and it is for free, maybe you may not join it because you are not given anything. The money is very limited. If you are a student, if you have the student ID card, you can give it in the forms, and then it will be for 299. If you are a professional who wants to learn all these things, then it will be for 499. So I do not expect much from this workshop, and I am very happy to see you all here. And this is what I had the initiative in my mind. So yeah. And even if you are someone who is not able to afford because of any reason, I will be able to if you are a student and if you are not able to afford it, I'll be able to give discounts and all as well, because this thing I'm not doing it for money's sake. I'm doing it just to have a commitment from you all, and that is what I have in my mind. And yes, thank you all. And yes, so regarding the certificates, you will be getting the certificates once you fill the feedback form. Feedback form is very important. That will help me understand and help us understand what kind of roles and like what kind of contents you love, you enjoy, and what should be the iterations made in this type of things. Also, yeah, that's it. So any questions, I'll be open. I am open for questions now. Okay.
Yeah. Hi, Sanjana. My name is Divakar. Thank you very much. This is a very insightful session. I have attended many of the other AI, so-called AI sessions, but found almost zero value. But this was really, really a valuable one. So I'm based out of Sydney. It's almost 12:30 midnight for me. But your whole presentation, I really was very helpful. So my just question is the workshop you're going to conduct. May I know what is the timings like?
It will be mostly on Saturdays, Sundays, and I guess 6 p.m. this time we will try to keep based on
6
our
p.m., right?
abilities.
Yeah. Okay.
Yeah, based on abilities.
Okay. Yeah. So because I was just we are to India to Australia is around 5.5 hours difference. So
Okay.
I was just
You are from?
I'm from Sydney, Australia.
Okay. Nice to see you. Actually, I got to know that there are students who joined from overseas as well. Along
Yeah.
with that, so I was happy to know this response.
Yeah, thank you, sir. It means
Thank
in
you.
very less time you really brought in a lot of clarity. Thank you.
Thank you. Thank you.
Appreciate your work.
Any other questions or anything else?
Yeah, hi.
Hi.
It's okay.
Hasti.
Yeah, so I wanted to ask that right now I'm a medical undergraduate pursuing my MBBS at in Mumbai. So
Okay.
I wanted to, I'm very much interested for your program, and I wanted to ask like for consultancy, like I'm advising healthcare startups at my level right now. So would you be providing networking options and
What is what year are you in right now?
right now I'm an intern.
Okay, internship. It's a okay. Huh? So actually, I may not guarantee that I'll find companies and I'll find you places, but yeah, I will say that if you gain the knowledge and all, then consultancy you will be able to join. Let's say I myself have dentists at my team who actually work and annotate, and I provide them some certificates in that they have did some work in AI. So if there is some medical company, I know few companies as well, I may help you that way, but I cannot guarantee that I will give that the person will give you job. But yeah, I
Yeah,
may help.
yeah, that's what I wanted to know. And I had another question about your startup.
Yes.
You basically analyze X-rays using AI, and
Correct.
like you said, it cannot take the responsibility
Correct.
about the diagnosis. So,
Correct.
how do you go about integrating radiologists, like who actually interpret X-rays? So, how do you integrate the AI, like your startup, into the clinical practice? I wanted to know that.
Okay. Let's say that a patient comes to the clinic and the software is provided to the doctor. Okay, so it is not going to be directly predicting the x-rays which are being inputted by the patients. It is going to be in the clinics. It is going to be the into the government hospitals. So there a patient comes and the x-ray is given to the platform. What the platform will do is it will analyze. Let's say there are 32 teeth in an OPG. So all those 32 teeth will be analyzed and then reports will be generated. But after analysis, the doctor will see what it has analyzed, and then only that report will be given to the patient. So that is how the platform is. And along with that, we are also trying to integrate multiple approach as well. So that is how it is.
Okay, okay, great. All the best to you.
Thank you. Thank you.
Hi Sanjana, am I audible?
Yeah, you are audible. Hi, Samriddhi.
Uh, hi, my name is Smriti. I'm doing my MBA and my majors is healthcare analytics. So I have a Bachelor's of Science degree from Delhi University. So currently I've also interviewed for PwC and I interned at Grant Thornton in their healthcare transformation consulting unit over the last summer. So
Okay.
basically, there was no major mention of consultancies in the whole presentation, although they also work in the digital transformation space, and a lot of AI related projects are there. So I just want to know how can this course prove symbiotic for myself as well, if you can stress upon that you are going
Regarding
to
like
conduct.
you want to transition into consulting or what
So
exactly?
actually, I am already working in healthcare consulting. I just want to advance my knowledge of AI in healthcare.
Okay.
So that is, but
Okay, I'll
I
say
can't make out how matlab this will be beneficial for myself as well.
yes, okay. So let's say you are working in consulting, so you will know only things which are related to, let's say, analytics or companies and all MBA sort of things. Any
Yes.
any consulting firm will have that kind of knowledge. So if you want to transition into AI in healthcare means you need to know some sort of coding.
Hmm.
You need to know some sort of coding. You need to know what how the models are. You need to know some amount of machine learning, some amount of deep learning,
Hmm.
and you must be able to see how exactly the models is predicting, where exactly it is hallucinating is nothing but it is giving false outputs.
Hmm.
So to understand all these things, and also like this course is for healthcare professionals, so we will be taking things which are very basic as well, like how to build slides from Gamma, how to build slides from other AI tools. If you are a startup owner, then what kind of platforms are available to build your websites. Then also for startup, how to gain fundings, how to build that, all these things comes into it. So it's not just AI in healthcare. So that is what I'm so that is how it is going to be helpful if you feel it is going to be helpful for you.
Okay. Thank you.
Yes, thank you. Okay then. Okay, then thank you all. And also in the feedback form, there I have mentioned something named as video testimony. So if you are, yeah, wait, Runit, if you are someone who wants to get some sort of discount or something on that package as well, and even if you felt that this workshop is helpful for you and it provided some value, then please provide us with a video testimony saying that how you felt about it so that we can post it on our social media, and other people may also feel the same, that whether the workshop is going to be helpful for them as well. So I request you all of you, so if you can provide a video testimony, it is not required section in the feedback form, but if you can provide it, it will be very helpful for me. Thank you. Yeah, Runit, you can speak.
Hello, Dr. Sanjana.
Hello.
Dr. Runit here. So I am also a dentist. I'm a oral and maxillofacial surgeon.
Hello.
So the thing that I would like to know is that I frequently hear that a lot of healthcare startups are coming up, and they receive a lot of grants, and they are receiving private funding also. But like, are you aware of any AI related startup which is actually profitable? Like, they receive funds, they receive grants, but have they actually made profits? Like, are you aware of any AI startups?
Yeah, that is what I'm not actually aware of it, but because because it is something which is very new in India, and anything to build will take 2 to 3 years. Like for example, from 2 years behind, ChatGPT came. Before that, ChatGPT was not there. Right now, there is a boom of AI healthcare startups, and that is the reason why there are so many government funding communities as well who are actually especially giving grants to people who are building AI related or deep tech related startups in healthcare or any other domain. So maybe they are not right now what do you call profitable, but in future 110% they will be. I don't know whether my startup will be profitable or not, but someone will be able to do it in the correct execution, and that is going to be the future, and that AI is going to be integrated everywhere.
Okay, so I would like to, since this is a good opportunity, I would like to share my like concern. So I have basic AI literacy, like what you call it, literacy level. I know and how AI works and what is the kind of work that AI is currently doing. What I am interested is in, trying to actually do some kind of a project, and try to get a publication based on that. Maybe some kind of like you're doing multimodal analysis.
Correct, correct, correct.
I don't know what are the
So,
different.
regarding the publication and all, I would like to say that if you want something to build a startup out of it, then you cannot actually publicly paperize that content,
Okay.
because it is going to be your IP, or it is going to be something which is built by you. So it cannot be publicly available for everybody to read, because it is something which is you are going to build. So that is not a right approach, what I feel. So but if you say that you actually want to run a startup as a side thing, or if you are actually practicing doctor, then I would say that you can hire technical people, you can have some funding, you can create some POC with your idea in your mind, whatever idea you have, then you can start it. But thinking about it as a research thing, then it is not a good idea. Research thing only becomes well if you are in professor level, or if you are in an institute level where papers published on your name matters. But especially in startups, mostly startups focus on keeping their things very private. So publishing a paper is not something which I would recommend.
Okay, and like there are a lot of startups coming up that use oral images, oral cancer detection. These are like the same project but multiple stakeholders. Like some different companies are working on the same goal. So which company succeeds, and do you think it's a competitive thing? Like,
I think it is based on execution and the founder's mindset. How executive is the founder, and how dedicated is the founder. There, I also worked in a company who is actually building the same sort of thing, detecting oral cancers through oral scans. So right now, they are also in the startup stage only, like manufacturing stage. So, what kind of startup will win? That is something which we cannot predict at the start, but actually it depends on the mindset of the founder. Let's say there are 95% of startups which are going to fail, only 5% is going to pass. And if there are if venture capitalists or any investor invests in 100 startups, only 5 startups are going to boom, but you will get all the money from that 5 startups itself, like even more than that. So that is the level a startup can grow from zero to hero kind of thing.
okay, thank you. I won't take much time, so we'll connect later, I guess.
Okay, then thank you all. Thank you for your time, and thank you for attending it. Thank you so much. Bye bye.
Yeah, thank you, Dr. Chandana. Thank you very much.
Thank you. Thank you. Thank you.